And that's what most of our interventions do. They help one phase of this process, but then we depend on your own inherent healing to happen. And with chronic inflammation, there's been a glitch in that system. The body didn't get the right signals. And so what we have here is a failure to communicate, and then they just blow them away. It was the days when the movies didn't have to have perfect endings.
Cures, Remedies, and Beyond podcast with Dr. Irina, a Stanford-trained medical doctor, inventor, and a published author with over 30 years of clinical experience, is bringing together the science of medicine and the art of healing for ultimate vitality and health. It engages in discussions with healthcare providers, wellness experts, innovators, philosophers, spiritual and industry leaders, as well as health and wisdom seekers to provide you, the listeners, with practical tips and knowledge to help optimize your health and well-being. The Cures, Remedies, and Beyond podcast with Dr. Irina.
Welcome to the show. Today, our topic is chronic inflammation. And nowadays, scientists even call it a silent killer. The reason inflammation is so critical is that it has been found to be a player in almost every chronic disease, which affects approximately 130 million Americans, or more than 40% of the total population of the United States. In fact, more than 50% of all deaths worldwide are attributed to chronic inflammatory diseases, from cardiovascular to diabetes, rheumatoid arthritis, Lyme disease, and many others. To help us to unfold this complex topic, we have invited our special guest, a medical doctor with over 40 years of clinical experience, internationally recognized expert in treating complex chronic illness, a wonderful clinician, and the founder of the Gordon Medical Research Center with the clinical practice in the San Francisco Bay Area, Dr. Eric Gordon. Thank you for joining us, Dr. Eric.
And thank you, Irina, for having me. It's really a pleasure.
You have a very personalized and, I have to say, very caring towards your patients' approach in treating unique and difficult to diagnose illness. You're also a leader in organizing medical symposia with a focus on Lyme's disease, autoimmune, and other chronic diseases. And you're a co-author on a groundbreaking published study, Metabolic Features of Chronic Fatigue Syndrome. Being an expert in the field, I have a few questions for you, Eric. And I have to start with the main one. Inflammation is a part of the body's defense mechanism. It is the process by which our immune system recognizes and removes harmful and foreign stimuli and begins the healing process. But there are different types of inflammation, and I wonder if you could enlighten us on the differences between those types. And why is it such a big deal? And why with the chronic inflammation, and why is it getting so much attention these days?
Well, thank you. This is an issue that's fascinated me for years because, medicine is wonderful at treating acute inflammation and, acute illnesses, because inflammation, as you said, is your body's response. It's the self-protective mechanism. And the simplest way to explain the difference between acute inflammation and chronic inflammation is just that when inflammation persists, and becomes chronic, it's now hurting you, But it's like any useful self-defense mechanism. I always compare it to anger, because that's something that everybody can really understand is, if there's something dangerous that's about to happen to you or someone's really being abusive, being angry is self-protection and an appropriate response. Staying angry isn't. Okay. And you can see that in every organization or family that you've ever been in. If somebody gets angry at you for a reason and they let go of it relatively quickly after it's been resolved, life goes on and you can actually forget and heal. But if they stay angry and they're acting angry every day, the system kind of devolves. The family life gets a little strained. Organizational life is not as good. So in the immune system, we have the same situation. Acute inflammation has a process to go through where first there is a little bit of tissue destruction because your body's may often kill a bug, that first step. And then you have to repair cells. And then those repaired cells have to learn to communicate with each other. And then you've kind of finished this healing cycle. Okay. And if that happens like it's supposed to over a few days to a few weeks, even up to even sometimes it can take a few months. Well, that's health, but unfortunately what is happening today ever more frequently is this cycle is being interrupted. It's being prolonged, and it can be prolonged in any phase. You mentioned being co-author with a paper, and I always thought that's a little generous. I am a co-author, but I supplied the patients. And as I say, the fellow who wrote the paper, Dr. Robert Navio, supplied the brains. This is his work that I've been really building on for the last 10 years. The concept that he originally called the cell danger response, and now he's wanting to kind of morph it into the healing response. But still, it's how our body responds to danger, and that danger is infections, toxins, any kind of chronic stress. And how if your body can respond, heal, and in the healing, turn off that response, life goes on in a very fertile and exciting and healthful manner. But if you hold a grudge in your immune system, you don't do well. And that's where America is today, or the world is today.
That is very interesting and very good analogy, I have to say, the anger response. Are you saying that the chronic inflammation, it's almost like a certain confusion of the immune system that instead of finishing the job of eliminating certain pathogens or certain, triggers, so it keeps bombarding our body and our system with this inflammatory biomarkers and damaging our whole body along the way?
Well, that's exactly it. It's a failure to communicate. Okay, the communication is broken down. That's a line from a very old movie, but anyway, it truly is that our body is a constant interactive. Everything is moving in 3 dimensions constantly, and the way we think about injury, the way we think about illness, is based on a linear model of A causes B. There's a cause, and then there's an effect. And if you know what the cause is, and you address it, then you're going to be returned to health. What that model forgets about, and that model is best shown in our modern healthcare, where if you have a car accident, or you break a leg, you have a severe injury, you have a heart attack, a stroke, we now have really great responses. Okay, that will take care. It will tend to stop the bleeding so you don't die. Will sew up the wound. If you have a heart attack, might be able to open the blood vessel. The same thing with a stroke. If they can open it quickly enough, voila, you can avoid a lot of damage. But this model depends on this thing that Dr. Navio called the cell danger response, or the healing response, or as I like to think of it, the black box of healing. Okay, it requires healing, and healing is what is not happening correctly in chronic inflammation. So if you're lucky, you get the pneumonia. Hopefully not. You're only not lucky to get the pneumonia, but lucky enough to get the pneumonia in the day and age when we can give you an antibiotic, even if you're fairly sick, and you're better, wonderful, and your cough goes away in a week, and you might be tired for 2 weeks, 3 weeks, maybe even a month. But most people within 4 to 6 weeks, they're pretty good. By 3 months, even after a pneumonia, most people are, pretty much back. That worked because your body did the healing. The only thing the antibiotic did was help the killing phase. And that's what most of our interventions do. They help one phase of this process, but then we depend on your own inherent healing to happen. And with chronic inflammation, there's been a glitch in that system. The body didn't get the right signals. And these signals, what's interesting about Dr. Navio's work is that he puts the mitochondria, an organelle that, mitochondria are always been considered the energy producers of the body. And I think most people have heard of them by now, but, inside your cell, you've got a nucleus and you've got a bunch of other little particles or little organelles, as we call them, and workstations, if you will. And one of them is a mitochondria. And that makes ATP, which is the energy of the system. And, but it actually does much more than that. And that's where chronic inflammation arises usually, is when that mitochondria, which is also responsible for communicating to the nucleus, to the brain of sort of the brain of the cell, and also to the cells around you, that there's either danger or there's now safety. And when there's safety, you can go to the next step in healing and you can complete the healing cycle. But if those mitochondria never feel safe, you don't feel safe. and so the signals are all awry. And I went from the global to the tiny detail very quickly. So I'll step back in a minute, because I just how would you want to go with that to make it clear for people? Because it's a lot of ideas in a very short little piece.
Well, I guess one of my following question is the reason why we're still having difficulties, people to heal from chronic illnesses, is actually because the body has this very unique healing process that sometimes, practically the body is getting stuck in the cell danger response mode. Is that what you're saying? And that's why we're feeling sick for extended period of time, and whatever you do, you can't seem to get better. So, and the reason for that is because this little organelles that we have in every single cell of our body, as you mentioned. So the power stations of every single cell, without that, of course, the cells will not survive. So they actually start working towards elimination of this pathogen or some other thing, even after the pathogen is gone. And they're kind of almost like leaking that positive energy that the cell needs, and the cell doesn't kind of have enough of that fuel, that gasoline, to continue the normal functioning, and that is what we call that cell danger response. Correct?
Yeah, that's that is a nice way of putting it together. That the mitochondria, and one other thing I want to emphasize: the mitochondria are not broken. They're doing what they're supposed to be doing, because in the first step, when you get cut, when you get hurt, the cells are there to destroy any pathogens, any bacteria that have gotten in. So they have to release inflammatory chemicals, and they go into they're into self-protection. At that point, the cell membranes change. Actually, in that first stage of the cell danger response, the cell membranes actually stop being so permeable. They don't let in more information, and the cell becomes dependent on glucose. And this is a very interesting aside is that many people, when they're stuck in chronic inflammation, they only feel like they get energy from food when they eat carbohydrates or sugary foods, which is really the worst thing they can be doing for other reasons. But the one of the reasons that is your cell is able to burn glucose, sugar, without the mitochondria. It can do that really well by itself, and you can get a tremendous amount of energy from doing that. But unfortunately, it causes havoc down the line, and it's not a good long-term strategy. But that's that first step of healing is self-protection and making sure that cell is going to survive. Okay. Mm-hmm. And during that stage, the mitochondria is not trying to make too much ATP for inside the cell, because whatever's gotten in there, if that's like a virus infection or a bacterial infection, it wants to use your own raw materials and your own energy. So the mitochondria is protecting you. Okay. But if you stay there like that, well, then, and if enough cells in your body are in that same stage, you're tired all the time. Okay. Because remember, is that when you get sick, when you get a cold, it's rarely, the bug is contributing a little bit of the symptoms, but mostly the symptoms depend on what organs the bug are in. But they're really feeling lousy, that fatigue and brain fog, and that's from your own cytokines, the chemicals that your body is making, okay, to help kill the bug, make you feel sick. And that's why in severe chronic illness, you feel sick all the time. The most common type of chronic illness we probably have in America is more the diabetes and the heart disease, which people many times feel not so bad until the organ really starts to make noise. But it's still chronic inflammation. It's still parts of the organism are not finished the healing cycle. They've been injured. You know, in the heart, it's the blood vessels lining the major blood vessels, or sometimes the small ones, are inflamed. And your body's not able to stop that process. It can keep it quiet, but it's still ongoing. I said, it's like that smoldering anger that, I'm not too angry until I have a day when I haven't slept, and then I start snapping at the world. Well, that's an organ that's stuck in part of the inflammatory cycle, is that it compensates. I think what's so hard about this concept of chronic disease is that our model, again, is so associated, are not just the doctors, but every human being, not every human being, but especially Americans growing up on TV and understanding how medicine works, it looks like you get sick, we do something, you get better,
Instant gratification. We became a nation of instant gratification, including but biology is very slow, as we know. The healing
and complicated.
At an instant.
That's the point, is that it's not linear. Lots of things are happening in lots of different organs, and there's lots of compensation. So many people are so surprised when they suddenly get a diagnosis, but if they ever really stopped and slowed down and felt what was going on inside their bodies, they might have had some hints beforehand. But we tend to accept a lot of aches and pains and fatigue. It's just, I'm aging.
Yeah. And I guess the danger is because, as you mentioned, it can be silent or unnoticeable, at least, in the early stages, so I guess that's why some scientists call it a silent killer. So I have a question, like, could you give us some examples of what are the triggers, so what are those particular, problems that can actually trigger this chronic inflammation that you see, among your patients in the clinic?
Well, I'm going to jump in here, but it's so interesting because, typically we always said, in chronic infections, like just even things like the herpes family, like Epstein-Barr, which people are talking about now. But, almost everybody on the planet gets Epstein-Barr within the first 20 years of life. The rest of the planet, other than, the West, gets it usually within the first 3 years of life. It's these viruses that we co-evolved with, they're not there to hurt us. We kind of dance with them. But if they if they irritate the immune system too much, they do hurt us. But so there's the viruses and the bacteria and parasites are the big ones that people think of. And what I think in this day and age is probably as important is toxin levels, okay? Because what's mind-boggling, if you look at heart disease over the last 130 years, in even cancers, okay? Because both heart disease and cancers were well recognized by physicians, okay, for the last 1,000 years. Literally, there's really good description, probably longer than that, but there's good written descriptions of all of these diseases. So, it's not like doctors did not recognize when someone had cancer, it just after 1900, the numbers just started going up and up and up and up and up. Early 20s in Germany, they started really studying cancer because it was a new thing. The numbers, it's just fascinating how these things were going up. And, and then there have been like leaps, and the same thing with heart disease. Heart attacks were well recognized. Angina was well described. It was very rare. And it wasn't that everybody died when they were young. That's just another, this story, because, when we look at it, that comes because they looked at the average age of death or the median age of death. But, when one out of three kids, there was so much death in that first few years of life up until the last 100 years that lowered the lifespan. But there were plenty of people living into their 60s and even their 80s in England, in the last few hundred years. And we have good documentation. There wasn't a lot of angina. Suddenly it's overwhelming. Something happened to how we're living. And of course, the food supply being the big thing. And in the last 40 to 50 years, since 1980, it's almost it's 40 years. It's gone nuts. Look at the autism levels.
Yeah.
Even if you subtract that they've changed, they have loosened the diagnostic criteria, but they're still through the roof. In the 60s, if you were at a medical center and there was an autistic kid, they would call all the residents together. Because this was
rare.
Unusual. Yeah, it was rare. When I started medicine, thyroid disease was a little common, but now it's a dime a dozen.
Yeah.
All the Hashimoto's and the hyper and autoimmune diseases, even in the last 20 years, have skyrocketed in young people.
Right.
Okay. Right. Colon cancer we weren't screening colon cancer under 50, 60, and now they're saying we should be screening people maybe in their 30s.
Oh, wow. Interesting.
We thought that colon cancer would happen to somebody in their 30s. It was a rare thing. Not anymore. And this is in the last 10, 15 years. The same thing with inflammatory bowel disease. Rare in children. They never saw it in kids. Now?
Like Crohn's. Mm-hmm.
Yeah, Crohn's, ulcerative colitis. Those were very rare in kids under 10. Didn't happen. It happened, but it was rare. No longer rare. I was just speaking to a rheumatologist saying one of the greatest problems they have is they don't have enough pediatric rheumatologists, because it wasn't such a big. Anyway, so the point I'm trying to make is
like
these
juvenile rheumatoid arthritis. Mm-hmm.
Yeah, all of
and
these
other
things,
diseases,
all autoimmune diseases.
Right. Eric, what do you actually attribute, such a exponential growth of all these illnesses, within our century?
Maybe the 80,000 new chemicals that we've thrown in the environment that we have no idea what they do.
Wow. We have 80,000 new chemicals?
Something like that. It's a ridiculous number,
right.
Yes, of new chemicals that in the last, probably 50, 60 years. We are living like young men. You ever want to, watch people take risks, get a bunch of teenage boys together, they have no idea they're ever going to die or get hurt.
Exactly.
Okay. Unfortunately, our planet is being run by people with that same mentality because as long as they're okay and they don't realize that, you can protect yourself, but not, we're just destroying without thinking. And, and again, I don't have any great answers, but because we all love the life that we have created of, better living through chemistry. All the stuff we have, the the conveniences, they're wonderful. But I don't know which one it is. But, when you have these, correlation is not causation. We have to be careful in medicine. We don't want to, we can't say that A caused B necessarily. But when you just look at these incredible increase in numbers, I don't know which chemical. And the thing I worry about is maybe the EMFs are much bigger deal than we want to acknowledge. Again, it's hard to prove things.
From the cell towers and from the cell phones that we are
sitting next to all day. Who knows? Because the research, unfortunately, is being done in a very tiny amounts. And because it doesn't kill people quickly, the deniability is, if my job depended on something that somebody is telling me there's maybe this will hurt people, but I can't show me any bodies, it's really easy to decide that maybe I don't want to look. I think we shouldn't expect everybody to be perfect people. So
that's very interesting. Yeah. We want everything to be perfect. We want everything to be fast and immediate, right? So, and we seem not to think about the future, a long-term future, how things affect us.
We never thought about long-term future, but we never could affect it so much as we can today. And and so getting back to chronic inflammation, so I have to believe that the environment is a huge part of it, and the emotional environment, the fragmentation of life. It's been the nuclear family has been for, up until 70 years ago or 60 years ago, it was only really the wealthy that didn't see their kids.
That's interesting. Wow, that is a very good point.
If you were rich, you had someone take care of the children.
That's
Otherwise,
right.
your children, for good or for bad. It made for it didn't make for perfect human beings by any means. Like I said, I've never met a normal person yet, but I do think that a lot of the anxiety and depression that we're seeing is because of the lack of the depth of human interaction that just happened, but as we went from TV, which was bad, but at least if you were watching 3 hours of TV at night, at least maybe you were sitting next to the other human being and pretending that you were interacting, or at least during commercials you did. But now people isolate. And they're spending anyway. So I can't think that's good for you. But and again, going back to chronic inflammation, we know that how you get how you get healing to start after you removed the irritant out of the system. Let's say you get rid of the infection, but in animal models, even is you have to give them, proper nutrients, but light, and social activity works everywhere. In animals who are like us. Social animals who don't live in groups, that's social is going to make them worse. But so when you want people to heal, you have to tell them it's springtime. You have to tell them that it's time to grow. Winter metabolism is a eating up of your resources and hanging down and getting low to survive, at least in the Northern European world. That's how it was. And summer metabolism is when you ate a lot, people gained a lot of weight, to survive.
So you can rely on the same storages, right, in your body. Well, that's interesting.
But I want to make the important point is that when you want to heal, you have to give the body the signal that it's safe. And part of the safety signal is the human interaction, just opening your heart. People need that to know. Because once you remove the noise from the periphery, so if you get rid of the organ damage, the brain has to send the final signals that it's time to turn off inflammation. And when the brain is under stress and in fear, it has a harder time doing it. Now, obviously, you can be a nasty, hateful human being and not want to see and still heal. The body is really cool. You don't have to be Gandhi to heal, or the Dalai Lama. We all manage to get by, but it's just the more that you can open your heart, the more that you can be at peace, the quicker and the more complete the healing will be, because I said, the brain controls the immune system. It's that simple.
Right. Is that through the vagus nerve? Like, you're actually getting into the state of the relaxation, nourishing kind of, attitude that your body, homeostasis, so basically that's sympathetic versus parasympathetic nervous system. So kind of start balancing. So there is more blood supply to the organs, and that is how that works, or
Yeah, absolutely. Yeah, this is relaxation. And the thing, the biggest kicker of everything is that relaxation takes more energy. Okay.
Oh, that's interesting.
Is that what people forget is that, forming a fist is like falling off a cliff, or hopefully not a cliff, but falling off something. You didn't have to put much energy into that. Okay. Now walking back up the cliff or that took energy. And it's the same thing. Relaxing your grip, your mitochondria had to make a lot of energy to get the system of relaxation going. Okay. That is just falling off the cliff. The contraction doesn't take much. And it's the same thing, is that it actually takes more energy to turn off the inflammation than it takes to turn it on. It's a easier switch to flip.
Wow, that's interesting. Yeah, that makes total sense. And it takes more conscientious effort, sounds like, to get back, into the total health. So we are going to take a quick break, but I do want to ask you after that, how do you approach your patients, when they end up in your clinic? I know that you do such unique testing, laboratory testing, and you combine it, of course, with your clinical expertise, so, and you definitely helped thousands and thousands of patients with their often unrecognized chronic illnesses. So, but we will be right back.
This podcast represents the personal views and opinions of the host and the guests and does not constitute medical advice. The statements contained in this podcast have not been evaluated by the FDA. Any products or treatments mentioned are not intended to diagnose, treat, or prevent any disease. And now your host, Dr. Irina.
And now we are back with our wonderful Dr. Eric. So, Eric, could you please enlighten us on how do you approach your patients? So you have such complex patients that typically see, prior to your clinic, so 15 different specialists, and you obviously able to help so many of them. So what is so unique about your approach?
Well, it's mostly just doing medicine the way it was always supposed to have been done, which is listening to people. Okay.
Right.
And also, and more importantly, realizing the interconnectedness of everything. Okay. Is that, right now in medicine, we have, just brilliant physicians. I learned so much from the specialists out there, but the specialists, unfortunately, don't see the connections between the different systems. The kidney specialist doesn't kind of think about, what's happening with your heart, or actually, but more importantly, doesn't really care, if you go to see the kidney doctor, I just picked the kidney doctor, but because you're having some problem with your urine, and the fact that you're also fatigued and have other pains in your body, that's information. So he takes that maybe this kidney disease could be making that worse. But if he evaluates your kidneys and they're not really bad, he's done. He's done his job. And so he didn't really think deeply about the rest of your symptoms, unless how they may be connected to his specialty. If it didn't, They were ignored. Not from any malice, just because that's his job.
How we train these days, exactly. Yeah.
Yeah, and so and that didn't used to be a problem, because it used to be like the primary care doctor was there, your family doc was there to like pull it all together, But now, I don't want to make it, but it's really true. The problem is that your primary care doctor has now been converted into what I call a triage nurse. His job is just to send you to the right specialist, or give you one out of the 6 medicines for your diabetes, or another group of 6 for your hypertension, and another one for your osteoporosis. And, but again, they have cookbooks of 3 to 6, sometimes 12. But if there's 12 medicines, 6 of them, they're probably lookalikes. They do the same thing, but slightly changed to make money from the drug companies. But you usually own like 3 to 6 basic medicines in each one of these fields. Though I have to admit, rheumatology is changing, because now we have a whole lot of special meds. But anyway, the point is that your primary care doc just uses a few medicines. And so if you fit those medicines, and on top of that, your primary care doctor is mostly looking for what I call Band-Aid medicine. He's looking to keep you from dying from your high blood pressure in 20 years from a stroke. Okay. Or keep your blood sugar reasonably under control, so you don't have bad things happen again 20 years from now, or give you a medicine for the pain because you hurt your back yesterday. But again, it didn't help you heal. All it did was cover up the pain. It didn't change why you have high blood pressure. Right. It just lowered it. It didn't change your diabetes. It just either increased your insulin, or got your muscle cells to take up the sugar a little bit better. But nobody is looking at what is unbalanced in your system, because that takes time, and you can't do that in the 7 to 10 minutes.
That's very true. We're biased. We're biased towards symptoms relieving, medical approach. This is not the
doctor's fault. I want to point out that this was not how medicine ever did it. Right. It's in the past, and I have watched it happen in the past 30 years. Yeah. They're now working for the company that they're employed with. They're no longer just your doctor. Okay, that is just an insane system, but welcome to what we've created.
You're touching a very important topic. But back to how are you different? How you approach it? What tests do you do? And
I listen to people first. I look at all their tests, and I look for underlying. We look for chronic infections that other people don't care about, because they're not killing you. They're just underneath, but they're keeping the inflammation going. They're not letting your body go back to peace, because they're still there. And
like what kind?
Oh, very often, Lyme disease, Bartonella, Babesia, these are called tick-borne diseases. And these are bugs that, most people probably get. I think the number of people who get Lyme disease is probably astronomical in America. And most people don't get much symptoms. They might get a cold, they might get nothing, because it's sort of like, even with COVID, when you think about it, people forget that half the people who had COVID, even in the beginning, didn't have symptoms. That's why it spread so much. When they
were just carriers.
It's like we are very amazing beings. So we don't look, but these bugs are often in our body. So even if we're not symptomatic, though, but our immune system is sensing them and reacting. And that's what I look for, because we're looking for what's bubbling underneath. We're looking for what toxin exposures people have had. There's chronic infections that doctors just don't even think exist in the jaw after wisdom teeth are removed, or people have had root canals. If your root canal still hurts you a year later, and even though the dentist goes, "Oh, it looks good on the X-ray," it's not. Okay.
So there is an underlying infection that actually can cause. Can result in so many different problems, including Alzheimer's, as we know, the dental health now directly linked to Alzheimer's disease. Yeah. Mm-hmm.
Absolutely. And the nose. They even know people who pick their nose seem to have a little bit more dementia. There's something, because the bacterial load in the nose is it may be more significant. And again, we have seen there are some people when we do treat what are considered just colonization, because there's a difference between infection and colonization, which we're not going to talk about right now, but it's basically bugs that just coexist with us or colonizers. But some of them in some people cause problems. And again, in the nose, and we can see that can be a cause of chronic illness. So the gut, of course, is a big thing. But usually by the time people have seen me, they've seen a few naturopaths who've tried to fix their gut. And it's often not that straightforward anymore. The probiotics, they're worth trying. If they help you, God bless. But when the system gets really out of whack, they're usually not as helpful. And so you really have to go back again and rebalance the communication to the gut. Because the other thing I think that makes my practice, I think, different than most is I also pay a lot of attention to structure. Okay. I do believe that when there's inflammation, that's not I believe, we actually know this is science. When there's inflammation, your ligaments get a little more lax, the things that hold your bones together. Ligaments are bone-to-bone connections. And if you tend to laxity already, like there are some people who can really touch their thumb to their wrist, I can't even get close, or bend their pinky down here. For some reason, they tend to have a little more trouble with putting out inflammation. And also, they can get irritation if they tend to be a little lax to begin with, and those top joints between your skull and your cervical spine, which your neck sits on, or your head sits on, that can be a little lax. And if that's even micrometers, it doesn't have to be enough that you know it, but
it creates like instability, and then
and you can irritate.
Inflammation.
You're talking about the vagus nerve.
Oh,
that's
I see.
That's a place the vagus can be irritated. And when that's irritated, it sends signals to the organs. So people start getting palpitations. They don't know why. All of a sudden they're sitting there, they think they're fine, and their heart starts beating. And then they get anxious. See, that's what so many people don't realize, is that a rapid heart rate will make almost anybody anxious. Okay? Because it's not something you have to think about. It's just that it's connected.
So interesting. It's not only one way. Yeah. So it's actually a reverse way as well. So
it's
anxiety causes more. And then okay, interesting.
Well, basically, the signs of anxiety will create anxiety. You don't. And we always think that anxiety comes first, but it doesn't have to. If your heart is racing and you're at rest, most people, their brain will start feeling anxious, will start feeling worried. They'll start to breathe a little faster, and then that anxiety gets worse because the rapid breathing changes the carbon dioxide, which changes in your brain, and it makes you anxious. So I think so the biggest things we do is, we almost never believe that anxiety is the cause of any disease. Anxiety will make every disease worse. Okay? So, there's no question about it, is that if you can learn how to relax, you will help yourself heal. But you didn't get sick just because you were anxious. There are millions of super anxious 80-year-olds out there and 90-year-olds, believe me, I used to do geriatrics, and you can be really anxious and still be somewhat healthy as an old person. But if you get sick, that anxiety gets worse, because the very, very we're talking again from the very beginning. What is inflammation? Self-protection. Okay. What is anxiety? Anxiety is your brain's attempt at self-protection. It's telling you to be on alert. It's telling you to worry because there's danger around you. And it's, the old story, if you're, huddled somewhere and there's either bad people or a large animal out there, anxiety is an appropriate response. But again, you want to modulate it, because too much makes you useless, but a little bit makes you alert.
Right. So it's a signal. Right. So it's a signal that we need to be aware of and actually use it to our advantage, almost, if you will.
But in chronic illness, oftentimes, especially if you have a little tendency, and most of us do, to a little obsessiveness, that gets when you're inflamed, obsessiveness gets worse. And in fact, the psychiatrists are beginning to realize that that really almost all psychiatric illness is inflammation. I mean, the modern literature, I mean, it's taken a while, but it's getting there. They're realizing this, and if you think about it, I mean, remember, the first antidepressant, amitriptyline, was designed for TB. I mean, it was a very tuberculous drug.
Mm-hmm.
I mean, it happened to make them happy. It didn't cure their TB, so it didn't make them happy.
Interesting.
It got them less depressed.
There is definitely more literature that now I'm aware of, and I read about even schizophrenia and seizure disorders. Actually, sometimes can be at least ameliorated, if not putting people into remission. So with the keto type of diet, so I was so impressed. So that there is such a correlation with the metabolic state, so in your food and psychiatric illnesses as well. So, and of course there is a feedback loop, as you said. So it's spiraling down, so.
You can spiral down, and the good news, you can spiral up. That's the amazing part of the body, is that we are self-healing. I mean, that's what we've always counted on. I said in the beginning, is that Western medicine got stuck at just fixing the first step and then depended on you to do the rest of the healing. And that works until you start polluting it to the point where it can't communicate well.
And how do you break that particular cycle, and how do you help people to get back to the health cycle?
But I call it pickup sticks. I mean, because you see, chronic illness is a disease of the individual. There's another very important point I want to make, is acute disease, we all act the same, or pretty much, you hit, like a broken arm is a broken arm. I mean, some people will scream and some people will just moan and some people just go out, but it hurts everybody, but the response and how we fix it is the same. You splint it, but because the problem is in the event. But chronic illness is how your body has responded over time, okay? The compensations that your body has made over time. And that is about you. That's a reflection of your genetics, of your life. So it's
your prior exposures, your, as you said, genetic family histories. Yeah.
Okay. So that's why the 10-minute office visit works if I'm treating something that is not about you. That, if you got a bee sting, if you got I said, a wound, that we can just fix, boom, gone. But if I have to figure out what's happening in you, we have to look at your genetics, as much as we can. Our biologic testing is still kind of not great, but we have enough different ways at looking at cytokine inflammatory panels, that give us hints. What's frustrating for the doctor and the patient is that when you're bleeding to death, the blood count is really clear. It means something. It's way too low. We got to fix it. But when you're measuring cytokines, so these inflammatory chemicals, they wax and wane. So we might catch them at a bad moment or a particularly good moment, and because they do so many things, just because your interleukin 8 is elevated, gives us a hint of what family of illnesses you may have, but it's not a diagnostic one-for-one test. It doesn't give me a particular name for what's wrong. But so that's what we do, is we try to get beyond the names. Okay. Yeah. People, we all love names. We want to know what's wrong with us. Okay. It's human nature. But sometimes it's really a lot of little things that are affecting your metabolism. And that's frustrating because we can always pull out one or two things and give them a name. But at the end of the day, it's 100 small steps that get people well. When we're lucky, there's always, that was the nutrient. That was the medicine. But that's not common in chronic illness. In chronic illness, it's remove, sometimes it's the mold exposure you have to remove. You have to clean up your house or maybe move. We don't like that. We try to minimize that because that creates a lot of stress. But, finding the chronic infection. Obviously, the diet is huge, but it's not like not like you come to me and I say, oh, go on a ketogenic diet, or, because there are people who at certain times in their illness, they'll feel terrible on a ketogenic diet. Mm-hmm. Without some carbs, they have no energy. They can't function. Other people, give them a ketogenic diet, they're heroes. They feel marvelous, and their system starts to do that upward spiral towards health.
So it's very individual, basically, as you're saying. But in general, do you think there are foods to eat and foods to avoid for healing, or?
When I was a teenager, I was really interested in diet. Okay. And the reason I went to medical school was I was working in the health food store, and they had the mucusless diet. They had, there was fruitarian diets. There were, like the wheat germ diet. There was, in those days, the macrobiotic, little bit of Atkins. He was just beginning to start, they're radically different.
Right. Okay.
But some people were healed by them. And so when I come down to the only thing I can tell you is, the first step is just clean it up. Just, if you can afford it, organic food. I mean, grass-fed meat. Unfortunately, that is the diet for wealthy people, because
it's expensive these days, especially.
Did some shopping the other day, and I shop at Good Earth. It's a very expensive. I mean, you can't compare, and that's the problem. Is we're not taking care of everyone. And if we're just not, if you walk down the average supermarket, everything that's in the people say on TV, if it's in the middle aisles and it's packaged, you probably shouldn't be eating it. Mm. And on that note, even if you're going into the Whole Foods, and the Good Earth is a store in Dark area,
in Marin.
They're not paying me. It's all organic and very nice, but it's not cheap. And even there, packaged foods, the things that are going to, like the vegan does, and the keto, most of that is, not most, but a lot of it is kind of garbage. It's not real food. Mm-hmm. I mean, eat food. Okay. You need the macronutrients. You need the micronutrients. We don't, eat stuff. Juice, avoid juice. Okay. Juice is terrible.
Really?
Fruit juices are poison. Okay. There's, what's his name?
Why?
Dr. Lustig, I forget his first name, but I think it's Robert Lustig. He's from UCSD. He's wrote a phenomenal, fun book called Metabolical, and it's really he was a pediatric endocrinologist who was just appalled by the disease changes. Anyways, it's a great book for anyone who wants to read about how insulin and glucose work in a way that it actually goes fairly deep, but it's written for the general public. It's
Metabolic.
Really excellent.
Mm-hmm. And what's the just the premise of why the juice is so bad?
Because it has fructose, and that's why all that stuff on the shelves is so poisonous, because it's fructose. Fructose is a sugar that evolutionarily allowed the great apes and our ancestors to survive, because when you eat fruit, the fructose slows down the mitochondria in the liver cells, okay, and gets them to not burn fat, but to store fat. Okay, it's a brilliant design, but it was designed to work for a month or two a year while you could do this to get ready to survive, and then not be an issue because you didn't have a lot of ripe fruit to eat. Okay, there wasn't fructose in the rest of your diet, or minimal. Okay, but now corn syrups are all these, everything, all the processed food is stuffed with fructose. That's what's causing the non-alcoholic liver disease.
Right.
Okay, that's why 40% of Americans have liver disease today. Right. I mean, the liver function test, the normal used to be 25 for the ALT and AST. Now it's up to 44. What? No. Right. The population has gotten sicker. It's crazy. Yeah. I mean, so anyway, so fructose causes your liver to stop burning fat, and I mean to stop and to store it, to make fat out of, and it causes insulin resistance.
Mm-hmm.
And then diabetes if you keep doing it.
Right,
I mean, so that's a bad food.
So,
I mean,
so basically,
food.
you're not against eating actual whole, apple or fruit. Yeah. So, but
Fruit.
it's the
Apples, those big grapes that they sell.
Right.
No, those are garbage. You want to eat those? Eat 2. Okay, they're loaded with fructose. Okay, because they bred them to be sweet and big.
Oh, they modify them.
Okay.
I see.
Yeah,
to have a concentrated amount of that fructose. Okay.
Yeah, because fructose is what makes it sweet. You want to eat an apple, fine. You want to eat a pear, eat 1 pear. Don't eat 3. You want to eat a peach, same thing. A mango, have a mango, but having 3 mangoes, no. Papaya, probably fine. Not much fructose there. Good enzymes. It's so. Yeah, but basically. Vegetables are home free. Grass-fed meats, fishes that are, what are they? They call them the smash fish. I always forget the salmon, the mackerel, and the small little guys, the anchovies. Hopefully not farmed. Farmed fish are probably going to turn out to be a huge disaster for nutrition and for your health.
So because of the mercury levels high in the other fish, right?
Garbage. I mean, again,
you're
feeding them fish food. You're not feeding them what fish eat.
Right.
Okay. It's like raising cows on corn.
I see.
We're basically making abnormal things, and we're trying to keep ourselves healthy. Okay. I mean, the cows that eat grass are different biochemically than the cows that eat corn.
Because of the micronutrients that they consume in the wild.
The fat, you feed cows, they feed them because they want the fat, And again, I mean, it's not so much eating the fat is the problem. Eating the fat is the problem because the corn is all full of pesticides and herbicides.
Right.
And it concentrates in fat, and you're going to go eat the fat. Now, if you eat a grass-fed, fat, it's probably healthy for you because there's lots of good things that we just learning about in fat, but they also concentrate lots of bad things. So it's eat low down on the food chain, as they say, is probably best for the planet, as much vegetables as you can. But I personally think that, that meat or good protein sources are really important for health, and especially as people age, because protein goes down, and if you have to be really careful, because age is chronic inflammation writ large. I mean, that's why we're all falling apart, is because we are getting inflamed, and more of our cells. We have more and more parts of our body that are or more organs that are inhabited by cells that didn't finish this healing cycle, but they didn't die. So you've got cells all over that are stuck in these like inflammatory stages of a lot of inflammation, rebuilding or learning how to communicate. And
is that called senescent cells?
Yeah.
Mm-hmm.
Well,
and you're talking about the inflammaging, right? So there's a new term, inflammaging, so that as we age, it's not necessarily healthy process. If you are full of inflammatory kind of
we all are, and our healing, our ability, again, some of us, the people who live to 100 and look well and never been sick, they're able to turn on and turn off this inflammation with ease. The rest of us don't do so well. We turn it on and we turn it off 90%, then we leave 10% kind of like futzing going around low level. But the beauty is, when you got 80 or 100 trillion cells, you can have a lot of them who aren't doing well until you can't.
And on that note, that was really wonderful.
Hope and
That's right. So it's not as bad, right? So at least you have empowered us, Eric, today. So, I mean, the pearls, of course, that you provided that were new to me, that rest, relaxation. So getting rid of anxiety is so important to, help our bodies to point towards the actual health and healing. So, not to mention, of course, food and appropriate testing. So, and I know that you do such a unique panel of tests, so from...
They keep changing. That's why they're hard to talk about, because we keep looking for ones that are going to give us a different window in on different parts of the system. And the last 10 years has been amazing, because, a lot of these tests eventually get to the mainstream, but we use them early on because they give us hints. They're not going to give us the diagnosis, but we need hints. We need breadcrumbs on this trail of how to unlock your body's healing potential. So it gets back to that upward spiral of returning you to health over time.
I love that upward spiral. Yeah. Well, you're doing such an amazing job, obviously, and you help so many patients to regain their health, so and I really appreciate you being here today and talking with us. So thank you, Eric. And how do listeners can actually find you? So if somebody would be interested in contacting your clinic,
if they want, they're on our website is named after me, gordonmedical.com. And there's just info at Gordon Medical. There's a little button to push, and I think that you can hook up with a what do they call that? A discovery call, which is you get to talk to I said our patient care coordinator, just to make sure. We like to make sure that people are the right fit. We don't want people to have have unreasonable expectations. One of the most depressing things for doctors to see somebody who,
unhappy after.
We just don't have the right tools for that problem, and we really want to be clear with that before and help people get their expectations. And and again, we like. I don't think of myself as the first stop in anybody's healing journey, because they're really, I think, always a good idea to see, a good naturopath or a good functional medicine doctor first, to make sure that you're really, got all those bases covered, because what we do gets involved and it's just, and also, if you've got something that's a rheumatological problem, a neurological problem, see one of those specialists, because they have insights that we can build on.
Right.
So it's not, I think, our work comes in when you've been there and you're not getting anywhere. That's when our services are really worth it to people.
Yeah.
Okay.
Yeah. And
we're not worth it for the first cut.
And you obviously have trained a lot of naturopathic doctors in your clinic, and you have a wonderful group, of doctors under your roof. So that's wonderful. Anyways, thank you so much. You're one of the most caring, conscientious doctors I have to say I've ever met, and I feel privileged knowing you. So thank you, Eric.
Thank you.
And
that's so sweet, especially coming from you. I really appreciate your skills, and your just the warmth that you show your patients and all of us. So thank you.
Thank you so much. Thank you for joining us at Cures, Remedies, and Beyond, exploring science and the wisdom of health and healing. We hope to see you next time.